Fortunately, BSA has not done much with the health form. It's the same thing that's been in use for the past couple of years, so that's good news. So there shouldn't be any new slams that are going to cause problems for us. As always, we need to remember that the forms need to be here for anyone staying in camp for 23 hours or more, and that's both youth and adult. As well as that if you are coming back, let's say you're taking life-saving and you miss a class and you come back for that life-saving class, you will need to bring your physical with you because you're on camp and you're part of the program. So anytime you're part of the program. And the same thing for an adult, if they just come up for a day and they want to be part of the waterfront and in the program, they will need a physical as well. We still have all the same forms as before. I believe you have first on your screen there the A form, which is basically the, hi, I'm healthy, I'm happy to be here, yes, I'm going to follow the rules. This is who I have as my parents. They are giving permission for me to be here, as well as the scout should sign this also. Now there is the green line is actually the scout or the scouter, because adults have to sign this too, and then there is the parent to sign for the scout that they're also going to follow that. On the same form there at the bottom, another important fact, accidents happen, people get sick. Having permission for people to drive or pick up is important, especially in this day and age. So filling that part with who can pick up and more importantly, who can't pick up, because we do want safety for all of our scouts and scouters. The next form is actually the B1, which is the general health history. This is filled out by you, the parent, the scouter, and the scout. You need to fill out home address, insurance information, kind of that health history. And it needs to be a complete health history. Just knocking off a few boxes is not a complete health history. So please do it completely. The next form is the B2. And this one is about allergies, medications, and vaccines. It is an important part. Most of our scouts do not have additional medications that they need to fill out, so they really don't have to worry about that middle part. But if they have some other medication that they're taking, they have to have the prescriber sign off on it, and that's the medical provider, which can be a physician, a nurse practitioner, a physician's assistant, but those are the ones that are making the medical orders. It can't be signed by a nurse or somebody else for that medical provider. It needs to be the medical provider. And Connecticut is also one of those states where you are giving permission as the parent or guardian of the scout for that medication to be administered. We do have another form which we will hit in a minute, which is the over-the-counter form. If there's medications on there that you want your scout to take, you would also put them there in this box as well. The next form is the Part C. That's the pre-participation physical. That's the, the passport that says, hey, you're cleared, you're healthy, welcome to camp, let's have a good time. That is completed by your medical provider as well. It's important that they fill out not only the left-hand side, which is the physical, but they need to fill out that right-hand side where it says examiner certification, because that's the thing that says, check, 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 yes, as completed. They are in good health. They can do X, Y, and Z. And then there's also a little blue box there that's important that, yes, we need to know who that medical provider is, what practice they're with, and how we can contact them in case of an emergency if we needed to. The form that I had referred to with B2 is the Connecticut Yankee Council over-the-counter medication form. And this is a medication form that was written up with our camp physician for the simple things. So, if they got a cut, that we can use bacitracin. That if they have a headache, that we can use some acetaminophen. If they have some muscle pains, we can use some ibuprofen. So there's a whole list of common medications that we can respond to. If there is something on this list that you truly do not want your scout to get, you can draw through it, you can initial it, and that will mean the fact that no, you don't want that medication given, but you cannot put in something else, because again, this list was made up with our camp physician. That's what we have in stock, and that's what is expected that we would follow, so you can't substitute something else. That's where on B2, if it's something you want to substitute, you would put it into that B2 and your medical provider would sign off on it. There are two things that are involved in this particular form, and that's the emergency EpiPen auto-injector and the Benadryl. Because those are an anaphylactic treatment, those are like non-negotiable. If your scout was actually having an anaphylactic reaction, we're 27 minutes from the nearest medical facility. We need to react, and they will be administered just because it's high safety, and we want to make sure everything is safe and going well for your scout. Some of our scouts do have their own EpiPens. They may have their own asthma inhalers. They have insulin if they're a diabetic. These are considered emergency medications, and that's emergency medications that they need to carry. It's not daily medications that they would take in the morning because if they have ADHD. These are specifically for a specific diagnosis that they would use, and it's rescue inhalers, not inhalers that are maintenance inhalers. This form was developed because the state of Connecticut said that they needed to have some proof that, one, the scout was trained and knew how to administer them for themselves. This form is set up such that your provider can say is trained, can self-administer, or is not trained and but can carry. Because the fact is that if they're having a problem, and they're having a problem, for instance, with breathing, having them move from the dining hall to the health lodge isn't smart. It's better for me, the health officer, to go to them so that we can deal with their inhaler, and then their inhaler is on them. So this is also not just for them to administer to themselves, but for them to self-carry so that we can use it in an emergency situation if that needs to be done. Again, this is signed off by your medical provider, printed and all of that stuff. We do recognize, although Connecticut did pass into law recently, like in 2020, I believe was the year, about religious exemption for immunizations. They had basically said that as of that year, they were going to do away with the exemption for religion for those people that were using that so that they didn't have to do vaccines. So technically, as of 2021, anyone entering kindergarten had to have immunizations no matter what. We can grandfather in anyone who still recognizes and uses religious exemption for a reason they do not vaccinate. So you still would need to have this form completed for us to prove that you have this. Your school probably has this as well because you're running it through your school, but we don't keep old copies. I've been telling people a while ago that they really need to hold on to these forms and use them year to year. So please make sure that you get that filled out. The only exemption form is actually the contradictory for medical purposes, that if their medication in the immunization is not there. The last thing I want to highlight is the generic action plan. If for some reason there is a medical issue that needs to be addressed and taken care of, this is a generic one that would be filled out by you, the parent, and the medical provider so that we know what to do in the case of an emergency situation. This is on our website. You will find all of these forms on our website. Along with those, the general action plan, there is a seizure action plan, there is an allergy action plan that are already completely filled out that you can take to your provider, have them fill it out, and present it. And as always, any questions or anything, please shoot me an email or give me a call. I like to hear about the questions before getting to actually when we are getting into the week of camp.